Hi, I'm Dr. Bhargav Rao from Pathofast Lab in Pune, and if you have symptoms like you feel constantly tired and exhausted, or you have noticed a large swelling somewhere in the area of your neck, maybe in front, or you have sudden changes in your weight, or you feel very cold when other people are in fact complaining that it's too warm, then your doctor may have advised a test called the Anti-Thyroglobulin antibodies test. And in today's video, I'm going to tell you everything that you need to know about this blood test. To start with, you need to know what is thyroglobulin, what is anti-thyroglobulin antibodies are, and what kind of a test is this. So, like you may be knowing that there is a small little organ in the front of your neck which is called the thyroid gland, and this gland is responsible for almost many different functions in your body, like maintaining your heart rate, your metabolic rate, controlling changes in your weight, and also making sure that you do not feel depressed and keeping you in a good mood. It has a whole host of functions. These are just a few. Now, the thyroid gland, as I said, is located just around your Adam's apple, and inside this gland there are a couple of different chemicals and substances. One of these is a protein called thyroglobulin, and thyroglobulin is basically the precursor, or in a simple way, if to make you understand a simple way, it's a step early on in the process of formation of your thyroid hormones. So the thyroid gland basically makes these thyroid hormones, which are simple chemicals, and these chemicals actually travel throughout your blood and they exert all the functions of the thyroid gland. In the step of making these thyroid hormones, the first part of that step is actually something called thyroglobulin, which is just a protein which later on then becomes the actual effective thyroid hormones, which are T3 and T4. So you can think of it as a stepping stone on the way to the formation of your final thyroid hormones. And that is why thyroglobulin is very important. If there is anything wrong with the thyroglobulin, or if something attacks or destroys the thyroglobulin, your thyroid won't work properly. That's the basic meaning of the thyroglobulin. In the next part, I'm going to tell you what anti-thyroglobulin antibodies actually mean and what all this has to do with your blood test. So I already told you what thyroglobulin means. Now I'm going to tell you what are the anti-thyroglobulin antibodies, which is what we measure in this blood test. So sometimes the body's defense mechanism, also known as our immune system, gets confused because of a variety of reasons. It could be something like a small incidental viral infection, or in some cases it's just familial, but the immune system gets confused and it begins to make proteins that attack this thyroglobulin. Now, why would it do that? Well, one of the common hypotheses is that the body begins to believe that the thyroglobulin inside our thyroid gland, inside your own thyroid gland, is actually some kind of a foreign substance. It does not recognize it as being something that belongs to the body itself, and so it begins to attack it, thinking that this is some kind of an intruder. This is a very simplified idea of what an autoimmune disease actually is, which is a disease in which the body's immune system attacks itself. So in these immune disorders, the body creates these antibodies, the immune system creates these antibodies, which are proteins that attack the thyroglobulin and begin to destroy it. In the process, the thyroid gland itself also gets destroyed, and it can sometimes overact, sometimes it can underact, but it definitely malfunctions. And these are the proteins that are responsible for causing all this. They are created by our own immune system. They attack the thyroglobulin, and that is why they are called anti-thyroglobulin antibodies, short form being ATA. Now, the blood test that we are discussing today measures the levels of these antibodies in your blood. So it goes without saying that if the levels of these antibodies is very high, your doctors may suspect that you have some kind of an autoimmune disease in which your body's immune system is itself attacking the thyroid, causing the thyroid to malfunction, and then giving you all your symptoms. So that's in short what this test actually means. It's a blood test that measures the levels of these antibodies, which normally shouldn't be there at all. So what are some of the common symptoms that you may experience which may give the doctor a clue that your thyroid isn't working properly and you may have high levels of these antibodies in your blood? So there are many different symptoms, but common ones include things like weight gain, feeling tired all the time, dry skin, constipation, changes in your heart rate. Your heart may beat very slowly or too fast. You may sweat a lot, or you may feel very cold even when the temperature outside is normal. So you may feel very depressed. There are many alterations which can take place to your mood. So there are a variety of symptoms that can occur. These are all related to your thyroid gland. They don't specifically tell us that these antibodies are elevated. They just tell your doctor that there's something possibly wrong with your thyroid gland, and as a part of the entire proper checkup of your thyroid gland, this antibodies blood test will be advised. It's usually advised as a part of a panel of several tests. It's not going to be the only thing that they ask for, but it often is advised as a part of the tests that are necessary for a detailed and thorough evaluation of your thyroid gland. So if you're going in for this test, you might be wondering about which are the actual diseases now that you could be having if these antibodies actually turn out to be positive. So there are a number of different situations or syndromes, diseases in which these antibodies may be positive. Some of these are things that I've listed on this page. One of the most common is something called Hashimoto's thyroiditis, just an autoimmune disease like I've already explained to you. Antibodies begin to attack the thyroid gland, destroy the gland, and so the gland does not work. Your thyroid hormone levels are low and you begin to experience all kinds of syndromes. Another one is called Graves' disease, in which the opposite happens. The thyroid begins to overact because of some of these antibodies overstimulating it. You begin to experience certain symptoms due to that, but even in Graves' disease we may find thyroglobulin antibodies in your blood. There is another very important situation in which these antibodies also are sometimes measured, and that could be if you are someone who already had thyroid cancer, it was treated, and now the doctors are checking whether there has been a recurrence. So thyroglobulin, the level of thyroglobulin itself as well as the anti-thyroglobulin antibodies may both be tracked to make sure that you do not have a recurrence of thyroid cancer. This is a rather rare situation. Obviously everyone hasn't had thyroid cancer, and if you're one of those people who has had thyroid cancer, who's had it treated, maybe you've had your thyroid excised, this is one of the tests that the doctors may recommend to follow up from time to time. Other than this, there are also situations where we have there is inflammation of the thyroid that sometimes takes place after pregnancy, just after delivery. This is called postpartum thyroiditis. So if you were pregnant, you've given birth, and now the doctors begin to notice some symptoms in your case which suggest something wrong with the thyroid, this is one of the tests that they may advise. It's called postpartum thyroiditis, swelling or inflammation of your thyroid gland after pregnancy, after delivery. That's another situation, as well as a broad syndrome called autoimmune thyroiditis, in which this is like a blanket term for all those situations where your body's immune system attacks the thyroid gland. So these are all the conditions or diseases which we may be trying to find by using this test. If we find something abnormal on this test, it might be pointing to one of these different possibilities. So how is this test done? It's a simple blood test. You don't need any special preparation before this test. You can provide the sample at any time of the day. You don't have to be fasting before doing this test. You can have all your usual medications, food and water prior to providing your blood sample. It's a simple blood test. They'll draw a little bit of blood into a vial. They'll test it in the lab and they'll give you the report. One thing you should remember is that you shouldn't have any biotin supplements prior to providing a sample, at least for 2 to 3 days, because biotin can interfere with the test results. What is the normal range of the thyroglobulin antibodies test? Well, I've just quoted one of the reference values. You can see it on the page over here. This is just a reference value that has been provided by one of the well-known international labs. But you need to remember that your lab may have a different reference range depending on the method that they're using, depending on the kit and assay that they're using. So please refer to the report of your own lab. This is just a normal range that many labs use because it comes from a rather reputed source, and that's why I've quoted it here. So in which cases could your anti-thyroglobulin antibodies actually be elevated? So these are just the same list of diseases that we are targeting to check whether you have any of these diseases. I've already mentioned them in the earlier slides, so I'm not going to discuss it again. You will find that if you have any of these diseases, there's a very high chance that your thyroglobulin antibodies will be positive. They'll be higher than normal. And of course, in the case of people who are recovering from thyroid cancer, this is not a good sign. If your antibodies turn positive, it could point to a recurrence of the cancer, so you need to consult your doctors immediately. One important thing to remember is that if your thyroglobulin antibodies are positive and you haven't done any of the other tests that are normally done in a thyroid panel, you should definitely go ahead and do them. This includes the FT4 or the free thyroid hormone, the TSH, the anti-TPO antibodies. At least these 3 tests you should definitely get done to make sure that there are no that you're not missing something else in the thyroid. You should usually also gonna have to have an ultrasound of the thyroid done, probably to check for any nodules. Your doctor will palpate and touch your thyroid, look for any nodules or lumps in it. So this one test is just a part of a detailed workup of the thyroid. If anything shows up abnormal on this test, you should definitely go ahead and go in for a detailed evaluation, consult your endocrinologist or your nearby general physician, and they will guide you ahead. If you have any questions, please leave them in the comments and I'll do my best to answer them. Thank you for watching this video.